How you doing, guys? And here we're going to look at the musculoskeletal system again in a little bit more detail. We're going to just take the lower limb this time. And here we can see all the muscles in the lower limb. And we spin around to have a look at the back, on the inside, the front, and then the outside lateral, okay? So we're going to start off with this group of muscles here called the quadriceps. Now these are individual muscles. There's four muscles in the quadriceps, but we don't want to name them individually just yet. So the quadriceps is what I'm looking for. I'm going to take this muscle here and just remove it. Okay, let's take this muscle away and remove it. And we take maybe a couple of these muscles away. Okay. So now we can see just these three muscles here, okay? If I look and just click onto the pelvis, I don't know why it's not just released. Okay, so I'll just take this muscle here, okay? Now, this goes onto the pelvis, and it's a front spine, so that's the ilium, and we have what's called an iliac spine, so we have an inferior and a superior spine. So this muscle here goes onto the anterior inferior iliac spine of the pelvis. That's where it originates, and then it runs through to the patella. We have one that sits lateral. Now if we just look away here, it doesn't cross over the hip, this one doesn't. So only the first one, the middle, the center one does. This doesn't. And then we have one that's medial, this one here. Okay. So they're the three that we can see, the superficial ones. We have one in the center, one medial, and then one lateral. They're the three there. If I was to take these away one at a time, so if I was to take that, we've got this one here, which is the deep one, okay? So this is the vastus intermedius. Now this is the deep one, but we don't really need to worry about which one's which. We can just see three don't cross over the hip, the three vastus muscles, only one does. And that's this one here. This one crosses over onto the hip. So this is going to cause hip flexion. If this was to shorten and pull forward, this is going to flex our hip and pull or raise my knee up. All the rest of the muscles are only going to pull through this tendon here, which joins onto this ligament here, so your patellar ligament. And that goes onto the tibia, and that's what's going to these four muscles are all going to extend our knee, so knee extension. Only this one does hip flexion, but the actions as a group of quadriceps is going to be hip flexion and knee extension. Okay, let's take a little look at these muscles at the back here now. So we have one here, and one here, and then one deep underneath. So they're the three muscles of the hamstrings. We don't need to know the names just yet. We will look at them in more detail later on part 2. But for the time being, hamstrings is going to be fine, okay? So if I was just to click this one, we can see that this lateral one here has two heads. The short head and then the long head here. But it originates here on the ischium, or the ischial tuberosity, and then it inserts here on the head of the fibula head. We have this one here, and if we were to click it away, we can see this originates on the tibia, on the ischium also, but it just inserts here on the tibia, so this goes medial. And if we were to take the deep one also, that's the very same. So from the ischium to the tibia. So we have two on the medial side, and then that two-headed muscle runs lateral onto the fibula. So we have three muscles here in the hamstrings, 1, 2, and 3. And they all cross over the hip, so they're going to cause hip extension, and all three of them cross over the knee onto the lower leg, one on the fibula here and two on the tibia. and they're going to flex the knee. So they're going to decrease the angle. If these origins or insertions were come up towards the origin, it would pull the heel towards our glutes, and that's going to flex the knee. So that's a quadriceps on the front of the thigh, 4 muscles, but we only want to know quadriceps for the time being. And then these 3 muscles that are hamstrings, but we only need to know hamstrings for the time being. Okay, now we've got the calf muscle in the lower leg. We have this muscle in the lower leg. We have the lateral head and the medial head of the superficial calf. So this crosses over onto the femur. So it will go lateral and medial depending on which head. So it's got 2 origins, and then it runs down and it inserts here on the calcaneus bone of the, which is just the tarsal in the foot. Perfect. Okay, so that is your gastrocnemius. That is the gastrocnemius. That's a superficial calf muscle. If I was to take that away, we're left with this deeper muscle here underneath. Now, the deeper muscle, called the soleus, doesn't cross over the knee. So this can't do knee flexion. Only the gastrocnemius can do knee flexion. But the main action of this is the same as the main action of the gastrocnemius. It shares that same common Achilles tendon onto the calcaneus. So if this were to shorten, it's going to pull the heel up and point the toe. And that action is plantar flexion. When I point my toe away from my shin, it's plantar flexion. So both calf muscles, both the superficial gastrocnemius and this, the deep soleus, is going to do plantar flexion, but only the gastrocnemius is going to do knee flexion also. So there's your 2 calf muscles. We have this muscle on the front also. We had a look at this as well. So we've got a group of muscles here. We don't need to know these muscles here. Only the 2 calf muscles. These we don't. This one we do. This is the tibialis anterior. And if I was to just click onto this, we can see it originates on the tibia, doesn't cross over the knee, so it has no influence of any action involving the knee. But we can see it runs down here onto the instep of the foot, onto the tarsal and metatarsal in the foot here. Now, if this was to shorten and pull back towards its origin, this toe would come back towards the shin, and that would be dorsiflexion. So the action, or the main action of the tibialis anterior, is dorsiflexion. But because it goes onto the inside also, it's going to pull the instep up and show the sole towards the midline. And that action is ankle inversion. When the sole turns towards the midline, it's ankle inversion. So your tibialis anterior sits at the front of the tibia and causes dorsiflexion and ankle inversion. Okay, we have a group of muscles here we can just see in the inside of the thigh. So I'm going to just remove a few muscles here. So let's take that away. Okay, so that's one of our muscles that runs from the ischium and the pubis. We can see this here with the pubic symphysis, the pubis here, and the ischial tuberosity here. So pull that away, take that away. Okay, so we've got some long adductors here as well. This is the gracilis, we don't need that for a second, let's pull that away. And then we have some shorter ones here. As a group, these are all the adductors. So we have adductor longus, adductor brevis, adductor magnus, and then we should have a little adductor minimus here. And then we have pectineus and stuff like that. So we have a couple of long ones of gracilis that we pulled away. We have a couple of long ones, but we don't need to know them. This group of muscle here, we can see it on the diagram, on the anterior view in the class work. We just have a group of muscles here on the inner thigh, and these are called our adductors. If we were to look at just one of them and see where it originates and where it inserts, if this was to shorten, it would pull the humerus in towards the midline and that action is going to be at the joint, so it's going to cause hip adduction. So the clue is the name, the adductor group. Okay, let's spin it around here and look at this big muscle on the posterior side. Now we have some smaller glutes here. We don't need that. I'm going to pull that away, and then there's a smaller glute there that I don't need. We'll look at them later on, guys. Actually, let's pull the TFL away. Okay, so now we're just left with this muscle here. If we look at where it inserts or originates here on the sacrum and up on the ilium, so your sacroiliac, and then it runs down and it joins this connective tissue here. We call the iliotibial tract, or the IT band. Okay, that's just a band of fascia that runs all the way down from your ilium. So it comes in from this TFL, this muscle here, that originates on the ilium, and it's an extension of that, so it runs down to the tibia. So our big glute muscle here, the gluteus maximus, originates here, runs down and joins in with that ITB. So what's going to happen is if this was to shorten and pull back, this is going to pull our leg backwards. It can't push it forward, it can't lengthen, it can only shorten and pull our leg back. So it's going to kick our heel back, and that's going to cause hip extension. So this is our biggest hip extensor. Because of the way it runs diagonally out to the side, it's also going to pull our hips open into lateral rotation. So this is a big lateral rotator of the hip as well as an extensor. So gluteus maximus is going to cause hip extension and hip lateral rotation because it runs out to the side. Okay, so now we've got one more group of muscles I want to look at here, and we can see, I'm going to just move this little one away. Okay, so we have this muscle here that originates on our lumbar vertebra, so 1 through to 5. And it just inserts there on the femur, so crosses over the hip. And if this was to shorten, it would pull our hips or our femur up into hip flexion. Also, we have this muscle here, and this sits on the ilium and also inserts in a similar place. So these are two individual muscles, but we always look at them together, okay? So we have the iliacus, and then we have our psoas major. And together they're called iliopsoas. It's spelt with a P because psoas has a silent P in it, so iliopsoas is spelled. But iliopsoas is that group of muscles. Now we can't see this in a diagram because it's just too deep, but it is our deep hip flexors, the group of muscles iliopsoas or iliopsoas. Okay guys, so that's a muscle in the lower limb, and a few of the bones that it attaches to. So just a quick recap then. So we have our quads is a group of muscles, 4 muscles that sit on the front of the thigh. Our hamstrings is this little group, not to be confused with the adductors down here. These are long adductors, just these muscles. 1, 2, and 3 are our hamstrings. We have our superficial carpi and gastroc, the one that's deep, so that is the soleus. We have this tibialis anterior that sits on the front, and we have our big gluteus maximus muscle at the back, and then we have our adductors and our iliopsoas. So that's just the muscles. We will look at them in more detail in part 2 of the muscular system, but let's just familiarize yourself with them muscles first. So when we're labeling our diagrams, it's just the simple muscles. We're not looking for the individual quadriceps. Thanks for listening.